Okay, good evening, guys. I have a discussion seed for you, but let me put it together, folks, and I'll be right with you. Give me a second, please. Tonight's discussion seed, we are discussing end-stage kidney failure, or ESKF. Give me 1 second, please. Gotta organize these. Okay, guys, be right with you. I have to stack these up, and then we can start tonight's discussion C. Okay, here's a concise summary of the article, Signs and Symptoms of End-Stage End-Life Kidney Failure. End-stage kidney disease, or ESKD, is the final phase of chronic kidney disease, where the kidneys function at less than 15% capacity. About 37 million Americans live with kidney disease, and those reaching ESKD often require dialysis or a kidney transplant to survive. If a person chooses not to undergo life-sustaining treatment, palliative care can provide symptom relief and comfort during end of life. As kidney function declines, waste products and fluids accumulate in the body, leading to compromised organ function and various physical symptoms. Through the article, though the article didn't specify them, this excerpt, if you'd like, I can dig deeper into what those symptoms typically include, or share how palliative care specifically supports patients with ESKD. Common symptoms of end-stage kidney failure, also called end-stage renal disease or ESRD, reflect the body's struggle to manage waste, fluid, and electrolyte imbalance. These symptoms can be both physical and cognitive, and they often intensify as kidney function declines. Okay. Function and various physical symptoms. Though the article didn't specify them in this excerpt. Okay, fatigue and weakness due to anemia and toxin buildup. Swelling, edema, especially in the legs, ankles, and feet, around the eyes from fluid retention. Changes in urination, including decreased output, darker foamy urine, or urinating more often at night. Shortness of breath from fluid accumulation in the lungs, or anemia. Nausea, vomiting, and loss of appetite caused by waste buildup in the blood. Your anemia. Itchy or dry skin due to mineral imbalances and toxin accumulation. Muscle cramps or twitching, often linked to electrolyte disturbances. Cognitive changes, such as confusion, difficulty concentrating, or memory issues, especially in older adults. High blood pressure, that's difficult to control. Sleep disturbances, including insomnia or restless legs. Metabolic or metallic taste in the mouth, or bad breath, often described as urine-like breath, often described as urine-like breath. In the final stages, people may also experience emotional changes like apathy, anxiety, or depression, and physical signs such as very little urine output, worsening breathlessness, or even bleeding issues. If you're thinking about how these symptoms might be managed, especially in the context of palliative care, I'd be glad to walk you through that with you. For end-stage kidney failure, when kidney function drops below 15%, treatment focuses on replacing lost kidney function or managing symptoms. The main options include dialysis, hemodialysis. Blood is filtered through a machine to remove waste and excess fluid, typically done at a center several times a week. Then you've got peripheral peritoneal dialysis. Uses the lining of your abdomen to filter blood via a cleansing fluid. Can often be done at home. Home-based dialysis, guys. Okay, kidney transplant is a healthy kidney from a living or deceased donor is surgically implanted. This can offer greater freedom and quality of life than dialysis, but it requires lifelong immunosuppressive therapy or medication, guys. 3, conservative management, supportive care. For those who choose not to pursue dialysis or transplant, this approach focuses on symptom relief, quality of life, and emotional support. It's often guided by palliative care teams. Lifestyle and medical support. Regardless of the path chosen, treatment often includes medications to manage blood pressure, anemia, and bone health, along with a kidney-friendly diet and regular monitoring. Each option has trade-offs, and the best choice depends on the person's health, values, and goals. If you'd like, I can help compare these options more closely or explore how palliative care fits into the picture. Great question, especially since the choice between these two can significantly impact a person's lifestyle. Okay, now I'm going to go through a breakdown for you guys. Okay, and care goals. Here's a clear breakdown of the key differences. Feature hemodialysis. Blood is filtered through a machine dialyzer outside the body. Access point requires a vascular access fistula. Now that's a plastic intravenous tube that they hook you up to. Okay. Peritoneal dialysis uses the lining of the abdomen, peritoneum, as a natural filter inside the body. Requires a catheter placed in the abdomen. Okay, then you get graft or catheter. Location usually done at a dialysis center, can be done at home. Okay, schedule 3 sessions a week, each lasting 3 to 5 hours. Diet more restrictive due to intermittent treatment. Okay, then they go typically done at home, offering a more flexibility. Daily exchanges, automated, overnight or manual during the day. Okay, then you've got fewer restriction due to continuous filtration. Then you have infection risk, higher risk of bloodstream infections. Okay, suitability may be better for those with cognitive or visual changes. Higher risk of peritonitis, infection of the abdominal lining. Okay, requires manual dexterity or ability to maintain sterile techniques. Enhance, in essence, hemodialysis is more structured and often center-based, while peritoneal dialysis offers greater independence but demands more self-management. Would you like to explore how these options align with palliative care or quality of life considerations? That might be especially relevant if you are thinking about end of life care. Planning. The impact of dialysis on quality of life can vary widely depending on the modality chosen. Hemodialysis HD peritoneal dialysis, PD, or home hemodialysis, and how well it aligns with a person's lifestyle, health status, and personal goals. Here's what recent research and clinical insights suggests. 1. Physical and mental health. Home, home hemodialysis, or HHD, patients tend to support better physical quality of life at baseline and may experience improvements in mental well-being over time, especially in areas like emotional role functioning. Peritoneal dialysis, PD, offers more flexibility but may show a faster decline. In physical health scores compared to in-center HD or HHD. In-center hemodialysis HD often comes with more rigid schedules and transportation burdens, which can contribute to low baseline physical scores and more fatigue. 2. Lifestyle and independence. PD and HHD allow for greater autonomy, establishing patients to dialysis at home and often in their own schedule. This can support employment, travel, and social engagement. IHD, while more structured and supervised, can be disruptive to daily routines and more limited and may limit flexibility, especially for those with caregiving responsibilities or limited transportation. Diet and energy. Patients on home-based therapies often have fewer dietary restrictions and report more stable energy levels, likely due to more frequent or continuous toxin removal. IHD patients may face stricter fluid and dietary limits and experience more pronounced crash symptoms after sessions. 4. Emotional and social well-being. The sense of control that comes with home therapies can enhance emotional resilience. However, PD requires meticulous hygiene and self-management, which can be stressful for some, especially if cognitive or physical limitations are present. In short, home-based dialysis options support a higher quality of life, but they also demand more self-management. The best fit depends on the individual's medical condition, support system, and personal preferences. Would you like to explore how these differences might influence end of life care planning or palliative care supports that could be especially relevant given your interest in person centered approaches, patient satisfaction scores, offer value, valuability insight into how different dialysis modalities affect the uh, lived experiences of care. Here's what the data suggests: hemodialysis or HD in-center dialysis. Patients often appreciate the professional oversight and routine of in-center HD. However, satisfaction scores can be lower in areas like time spent with doctors and convenience, especially due to rigid schedules and travel demands. A European multi-center study found that while technical quality was related moderately well, 53.2% satisfaction with accessibility and time with providers varied significantly. 2. Peritoneal dialysis, or PD. Patients tend to report higher satisfaction with autonomy, flexibility, and ability to manage treatment at home. According to JAMA study, PD patients gave higher overall ratings for care compared to HD patients, especially in areas like communication and involvement in decision making. 3. Home-based hemodialysis, or HHD. Though less common, HHD is associated with higher satisfaction scores, particularly in physical well-being and emotional role functioning. Patients often feel more empowered and in control, which correlates with better mental health outcomes over time. 4. Common themes across modalities. Regardless of type, satisfaction is strongly influenced by staff communication and empathy. Physical environment of care. Patient education and involvement in decisions. If you're thinking about these, satisfaction trends might guide care planning, especially in the context of autonomy or end of life preferences. I'd be glad to explore that with you. Okay, guys, so that is it for today. And we'll see everybody tomorrow for shows. For now, Gator Wellness, take care, folks. Have a good evening. Talk at you later tomorrow.